This area here on the neck is not with the 4.5 but especially with the 3.0, the 3.4.5. However, you can still get an optional cartridges 1.5 as well if you wish. That is quite close to the muscular, the muscle area. This nice arrow, that area. In this video we're going to talk about a very important treatment of Hifu devices, which is the face treatment with Hifu professional devices. Now this is a part training video on our Hifu devices, so you can watch all our training videos on our website. Now let's talk about Hifu treatments for face treatments. Now, the part of the face that you can treat is pretty much almost all of it, which is we've got part of it here, this part of the face, this part of the neck. This got to be avoided, and so on. Look, this is part of it that you can actually treat. You can treat this area using the 1.5 or the 3.0, and this area only with the 4.5. So let's recap because I actually quite remember it. So the 4.5 you can only treat this area here, which I'm actually showing you here with the arrow. In terms of the distance between there and there, there and there, and there and there, I'll tell you right now. Now, let's say you're using a 4.5 cartridge, and we're going to repeat this information later on, and you can actually watch it in our training videos. What you do, you mark first of all you mark this area here, which you've got to avoid, and we'll see why in a second, because it's actually the mandibular nerve which is going up there, which I've got to avoid, especially with the 4.5. You mark that area first, then you draw a line that is very well clear from that area, and then with your cartridge you mark a distance between that line and the next line of 25 millimeter, and then you mark another line, and then from here to then once you've marked this line here, you mark another line from here to there of 25 millimeters approximately, there from this line to there, and then you draw the next line. And then usually, depending on the person, depending on the person, that area can be either 20 millimeters, 20 odd, 15, 10, or whatever. Really depends. So that's how you mark it with a 4.5. And then, with all instances, you have to avoid this mandibular bone because it's for two reasons. You've got the mandibular nerve in there. And also when you hit it with the cartridge it's quite painful and you don't do anything. So we'll teach you in our training videos how to place the cartridge. Basically, you must not place it perpendicular to that bone. So if you feel that bone, you must not place it perpendicular to that, otherwise you'll actually your client will feel the pain without much results anyway. But you cannot cause any more damage other than hitting the bone normally. And then you can treat this area here on the neck, not with the 4.5 but especially with the 3.0, the 3.4. You can actually go into this neck area as well, to this area. Always avoid this middle area here because there's a lot of cartilage which has got to be avoided. There's no point on treating it. And with 3.0, if I remember well, you can actually watch the Hifu classic device training. If you want to know more detail, then you can treat that area, this area. You cannot treat the mouth, but with a 1.5 you can treat this whole area here, this this area above on the forehead, this area here, and the mouth area, and as well as this area, because you're not going to go into the nerve anyway. So we're giving you a lot of information now with just this picture, but it's quite good. So then you're going to refresh this information so it's going to sink in as much as possible. So watch this video, very, very important. Watch this video and watch the other videos which we've already published. Very, very important training videos. And we give you all this information up front right now, so then when we talk about it again, it's only refreshing your memories, which is going to make this information even more important, for even more sunk in into your brain. Therefore, you're going to be part of yourself. So very, very important in the training. The key advantage associated with Hifu treatment is that it is completely a non-surgical procedure now. Very, very important, yes, it's a non-surgical procedure, but it's got advantages versus laser treatments, versus plasma treatments and so on. And these are mainly the fact that you never cause any epidermal damage. You don't scrape away the dermis. The epidermis, I do apologize, the epidermis is completely intact. Therefore, soon after every treatment, you can actually go swim. You can pretty much resume any of your normal activities without worrying about infections or anything of the sort. That's very, 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 very important. Also, because we're not causing the same type of thermal damage that we cause with plasma devices or lasers, there's no reported risk of hyperpigmentation due to sun exposure after these treatments. However, it's quite advisable to avoid sun exposure anyway, at least for 2 to 3 months. But there's never been any reports that we know of hyperpigmentation due to these treatments. Now, so there's a number of advantages. So you can actually resume all activities quite quickly, especially after this sort of treatments. So what is Hifu treatment? So it's a high intensity focused ultrasound treatment. If you want to watch our other training videos, they're going to be very, very important. You'll understand a lot. This is not a non-surgical alternative for facelift. You're not going to be able to offer a non-surgical facelift. Not true. Absolutely not true. You cannot compare the facelift results to this sort of treatment. With this treatment, all you get is some skin tightening and skin rejuvenation. That's all you're getting. You cannot get similar results to a facelift, to a surgical facelift. It's not something that you can compare whatsoever. Absolutely not. So it's not like a surgical facelift. So if your clients are looking for something dramatic, this is not it. This is only for some improvements in the appearance of fine lines and wrinkles, of the improvement of the appearance of saggy skin and so on, and skin tightening in general. So no dramatic results. Very, very important. And this focused energy can penetrate up to this mass layer, which is the layer which is quite close to the muscle. But as we have seen, this really depends on where you're actually working on the skin. If you're working on the face or working other part of the body, and the BMI of the person. So depending on the BMI, that's mass layer, you may hit it or not. It really depends. Because on a high BMI where there's a lot of fat on the skin, inside the skin, then that fat layer is a bit is thicker. Therefore, you're not going to target that area that is quite close to the muscular, the muscle area. And for the face, you've got 3 cartridges: 1.5, 3.0, and 4.5. Very important that. So if you want to know where you can treat with the different cartridges, you watch the Hifu Classic video. We already touched about it previously, but very, very important. If you want to know more detail about that, we've got videos on that as well. And our training manual, which is on our website, has got all details about that as well. So just just as a recap, see whether I cannot show you here with this because of the picture, but what is Hifu treatment for the face? So it's not a non-invasive facelift, okay? It's not a facelift. It's not a non-surgical facelift. It's not comparable. You cannot compare it with something that is surgery, and the results are no anywhere near surgery. So you cannot call it, do not call it a non-surgical facelift, for it's not that. It tightens the skin, yes. You get some skin tightening effects, yes indeed you do. Does it improve the fine lines? Yes it does. Shrinks pores and makes the skin look more radiant? Oh yes it does. Improves the overall skin tone and brightness and elasticity. Indeed it does that. So but do not cause the mistake of overstating what the treatment can do, as many people do in this market. That's it's very, very important that your claims are appropriate and you don't missell it. There's no point on misselling this because people go online and they do find the right information anyway, so don't missell it. There's no point on it. So we've got a different type of devices, but you've got here in the middle the Hifu Classic. Here on the right, in the top right, you've got the multi-line, the Hifu multi-line. This is another picture of another device which is similar to the Hifu Classic. Just a quick note, with the Hifu Classic you can actually use 3 cartridges for the treatment. Normally with the multi-line you usually use 2, the 3.0 and the 4.5. However, you can still get an optional cartridges 1.5 as well if you wish. Now, how does the Hifu treatment work for the face? Now, as I say, you've got to get we have 3 cartridges. Here in this picture we're showing you the treatment at 4.5, but mind you, this picture, this cut of this of the skin is not exact, because this adipose tissue thickness varies from person to person, so you cannot actually say that at 4.5 you actually accurately target this area. You can actually be in the middle, you can be above it. It really depends how much adipose tissue you've got inside the skin. Very important that, very, very important that. And then you treat the skin at, so first of all 4.5 on certain parts of the face, which is this area here, okay? So from here to there, and there from here where that jawline goes up to here roundabouts. If you want to have the good measurements, watch the other videos which we have made available for you anyway. And then the 1.5, so 3.0, which you can use in other parts of the face, which is we already talked about it. As soon as we've got a picture of that, we're going to show you. And the 1.5, which you pretty much can use it all over the face if you wish. And you get a collagen stimulation, you really naturally stimulate the collagen regeneration. That's what you do with this sort of treatment. So this treatment again reduces fine lines, sort of to a certain extent lifts the skin, to a certain extent of course. It tightens the skin, yes indeed it does. Improve the consistency of the skin tone, it does that. Improves the facial shape of jawline. The results are gradual and appear after a few months, and that is because you're actually not targeting the upper layer of the skin, the superficial layer of the skin, which is the epidermis. You're mainly targeting the dermal layer at 1.5, 3.0 and so on. Very, very important that. So it's a relatively painless treatment as well. So you've got the cheek, you've got the jawline, you can treat eyebrows, foreheads. You can improve the appearance of wrinkles. You've got skin tone improvement, and so on. Double chin, the V-line, the neck wrinkles as well. Now, for the 4.5, basically you can treat this area here up to the ear without going into this area here. And if you want to see that more into detail, then you can watch our videos. So only for a 4.5, only this area. With a 3.0, this area, and a bit of the forehead here, and this area. With a 1.5, pretty much the whole of the face, almost including the mouth, and so on. So, marginal mandibular nerve adverse reactions. Now, we're only talking about it because it is in the literature that some damage had been caused with these type of devices in the past. The good news is that when this damage had been caused, it was not permanent. So let's make a distinction between a permanent nerval damage and a non-permanent. Permanent means that the nerve has been, let's have a look at the nerve here. The nerve, for instance, has been cut, truncated, cut completely. And that's normally done using surgery. So this is why surgeons have got to be very, very well trained. They've got to know where they can cut and where not. They really need to know the anatomy of the body, because when they cut, they can cut things they shouldn't cut, and when you truncate a nerve, that is forever. It does not grow back. You cannot solder it together. However, if you cause an injury using, so far, all the injuries that have been reported to the mandibular, the marginal mandibular nerve, have been not a truncation, but more an injury to that. And injuries, nerval injuries at this level, at this type of nerves, they heal on their own. So that is a very, very good news for you. The other good news is that there's been very few reports of this sort of injuries, and we'll show you in a second what it can cause. But the good thing about it is that it does recover. It has so far no truncation of the nerve has ever happened. But it's something that you must know, and this is why we talk about a lot throughout our training information on Hifu. And is of temporary nature. So the damage can either be permanent or temporary. In our case, so far, for all the reports as there has been temporary, because you cannot, it's extremely unlikely to be able to truncate a nerve completely using a Hifu. The likelihood of that happening is extremely low. It's not as if it's impossible to happen, but it's extremely unlikely to happen. Let's put it that way. Now, the mandibular, so we're only talking about, especially we're going to focus on the marginal mandibular nerve, because it's the only injury that's been reported. So let's have a look at this. So it goes down. This is the one nerve we're focusing on, because the only damage that's been caused has been to this nerve. Goes down along the jawline, and also this. So there's two reasons not to actually go into that edge of the jawline where the bone sits, and don't place the cartilage just perpendicular to that jawline in this way. So let's assume you can actually put it perpendicular to your face that way, or this way, but not. So see where I can show you this way, not this way at 45 degrees, okay? This way is okay, this way is okay, this way is okay, but not directly hitting the bone, because you're actually causing a bit of pain for nothing, especially with a 3.0. not with a 4.5. You don't even want to go there with a 4.5. You're not causing much damage generally, but it's quite painful for nothing, because you're going deep inside the skin and you're actually hitting the bone a bit. And this is also where the nerve sits, but this is not where the damage has been reported. The damage has been reported at this level here, because this nerve, which you're actually seeing in here, it goes through here and it goes up, and the damage has been reported to this the part of the nerve that goes up to this the mouth. This is where the damage has been reported, and this is why in all the literature that you'll find, especially the ones that we publish, we always mark here the red X's, especially with the 4.5 and the 3.0. With the 1.5 is extremely unlikely that you can go as deep as causing damage to that nerve. However, you may be overcautious. You can actually be overcautious. It's not a problem. But we talk a lot about that, so you're going to remember that. So, and that is the sort of damage you're going to cause. So, it's not that you're going to cause, that it's been reported as being caused in the past. Look at this. This is why we mark it in red, so that you remember not to treat that area, especially with the 4.5 or even the 3.0. Now, let's say damage has been caused there. This is a sort of smile that you get. Very, very interesting smile. This is because that injury has caused that signal to not to get to that area of the mouth, and because the brain realizes that, it overcompensates on the other side of the face and here, and therefore if the damage is here, you get, when you smile, you get that sort of, this sort of thing that goes on the other. It seems as if the damage has been caused on the other side, whereas it's been caused on that side. So the damage, where the damage is caused, is you don't get much movement. You get the overcompensation on the other side of the mouth. So very, very important that as well. If it's a temporary problem, the good news is that everything is gonna be sorted out on its own accord. So you don't need to do anything. You can actually help the customer by helping them do a few facial exercise, but it's extremely unlikely that it's going to happen in your case because you know about this problem. If the nerval damage is due to a complete truncation of that nerve, there's nothing that can be done, and that is the only reports of that is after due to surgery. Due to surgery, that can only happen surgery or certain accidents where the injury is so severe that by accident that nerve can be completely truncated. That is all, and that if that happens, there's no cure, there's nothing. That injury is permanent. Now, why temporary marginal mandibular paralysis has been reported and why it occurred? Because of using injections improperly, using Botox, for example. Botox have got the effect of paralyzing the nerves, and if it's actually injected in that area, you get that sort of effect. Especially if you inject it badly, inject it too close to that nerve. This is why Botox can be a bit of a problem at times, because if you by mistake you inject it where you should not inject it, then you cause this sort of problem. Look at this. This is why we put it in our literature. Look, to avoid this area, we put in the very nice X's. That area is still full with nerves, but no injuries have been reported to that area, so it's not something that should be worried about. So also improper use of the 3.4 and 3.0, the 3.0 and the 4.5 cartridges. Unfortunately, by having this knowledge, you can avoid the treatment of that area of this area here. This area here with the 4.5 and the 3.0. Very, very simple. just remember, first of all, when you start the treatment, to mark that area. If you're using the 3.0 or 4.5, to just mark that area, this area here, and off you go. But fortunately, it can be avoided, and should it occur, it's normally not something that is permanent. These are so basically the marginal mandibular nerve damage can cause distress to the client, temporary damage, which is going to recover anyway. But in truncated cases, there's nothing that can be done. But it's not. It shouldn't. It's very unlikely it's going to be your case with Hifu devices anyway. But it's good that we stress and we keep stressing it, so you'll remember it. So how can the treatment be carried out? So first of all, we're talking about something that we get asked all the time. So what about power settings? Now, there's two, with Hifu devices for professional use, there's two schools. One is the old one, where doctors used to inject the face with anesthetics, which complete numb the whole face, so you have zero you don't feel any pain whatsoever. And the one that we recommend, which is, do not use any anesthetics, not even topical anesthetics, and then set the power level at the maximum tolerable level that that client can tolerate. So you start at the bottom level and you increase it, and keep a hand on the client's pulse, in the sense of keep asking, is it painful? Can you bear it? Can I increase the power level? Ask always the question up until you reach that top level, and then you'll find that when you go from one area to another, it can be more unbearable. If it becomes more unbearable, then you decrease the power level. What you'll find with our professional device range is that sometimes the pain threshold is so high for that particular client that you'll have to go into the advanced settings in order to bring down the overall power level to make it tolerable, even at the lowest power level of that particular device. If you want to know more about that, watch our the videos, the training videos on each particular device, which we've made available for you to watch. Very, very important that. And then always start with the bottom level, bottom power level, adjust it up to the maximum that your client can tolerate, and go there and don't go above it. Very important that, because that avoids bruising, avoids, especially at the beginning when you're not very familiar with this sort of treatment. You need to get confidence. You want to carry out treatments that are not too invasive, so it is much better. And also the pain that the customer will feel will also help you in not causing too much damage, like bruising or other stuff to the client. Because if you get too much energy delivered, you can cause some bruising, and bruising is going to go away anyway. But it's better you do that way, to be on the cautious side. Pain is a good thing, so use it to your advantage. And also, since you've got the pain, the client will feel it, so they know really well that you've done something quite valuable to their face anyhow. So whereas if there's no pain, they will not feel anything anyway. And when the effect of the anesthetic is gone, they really don't have the experience of that treatment anyway. So we recommend not to use any anesthetic. So so by doing it this way, by not using anesthetics, you're minimizing the risks of bruising. You're still going to get something, and therefore any other adverse reactions, including the potential of the the marginal mandibular nerve damage, that is even further minimized. But you still get a tingling sensation soon after treatment, and a few days after. You get that sensation. It's beautiful, because everyone who goes through this sort of treatment, they'll feel the treatment a few days after anyway. So they know they've done something to them. You're minimizing the any potential damage, avoidable potential damage, even if you do it by mistake. By being cautious and taking the precautions that we talked about, as to say, not going into this area, not going to the middle area of the neck, pretty much you've got everything. You do everything that you have to do in order to minimize that. And if you don't even use any anesthetics, you even further minimize that likelihood. So bruising is something that can always happen, but it will go away, and it will happen especially if you use anesthetics and you go very, very high power on. It's very normal reaction, but it goes away. Sometimes people get red dots on the face 2 to 3 days after. That's very normal. Happens pretty much 50% of the cases, and it goes away anyway. So first of all, mark the restricted treatment area first. So say, for example, if you're going for a 4.5 or 3.0, mark that area first in red, or put very nice X's so you know where not to treat the area, and then you do whatever part of the face that you want to do, or the neck. You do the drawings, you know how to make the drawings, so you'll do it again. Say, for example, for a 4.5, you can only treat this area here, which one's the one that I'm actually showing you with the arrow. Start by marking this area, making a straight line, making a measurement from here to the next line, measurement from here to the next line of 25 millimeters, which is the exact maximum cartridge length that you've got for the Hifu. Then you draw that very nice line. You draw a line there from the nasal, from the bottom of the nose up until that part of the ear. You just as straight as you possibly can. So you've got that line there, then you draw another line from here to there of approximately 25 millimeters again. Then make another mark from here to there, join these two marks, and you get hopefully a straight line. And then here you get residual area which you can treat. Normally is 20 millimeters or less, depends on the size of the face. And then you adjust for that area the length of the cartridge, because as you see with our devices, you can adjust that length from a maximum of 25 down to a minimum of 5 millimeters, if I remember well. So you can adjust that, but the point is that even if you don't adjust that and you just overlap the area, say for example here you apply all the lines at the right distance between each one, and then here when you do that, then you overlap the treatment with this area which you already treated, nothing really is going to happen. It's not going to be a big deal anyway. So you can do that, no problem. And then you can treat that area, this area, this area, this area, and so on, with, especially with 3.5. The 4.5, we advise you to treat only that area. With the 1.5, you can treat the whole area here, which I'm actually indicating with this nice arrow, that area, and the whole mouth as well, and the neck, and so on. Never the cartilage here. Never that middle area. So see, the area can be treated as well. So you'll find all this on our website anyway. So do not treat this area, the marginal mandibular nerve, that area here, avoid it. This area basically is that bone that you can touch here. This bone is going to be avoided, and if you're going close to it, it's still okay, but place the cartridge either this way, perpendicular to this part of the skin, or perpendicular to this part of the skin. Never a 45 degrees here. Just try to hit that bone. It's very unlikely you're gonna cause any trouble, but it's just painful because you're hitting the bone. That's it, especially with the 3.0 and the 4.5. Especially with the 4.5. With the 3.0 with the 1.05 is gonna be less likely anyway. And here you may have seen this picture before in other presentations. You've got lasers, IPL, RF, and fractional. You've got the advantage that you do not cause any injury or wounds on the surface of the skin, so the epidermal layer is still intact, so you don't need to put any to avoid any infections and so on. The ablation only occurs inside the skin, not outside. There's no bleeding outside of the face. If there's some bleeding, that can happen, but it's only internal. This is why you get the bruising, if you get it. And these red dots is also a sign of some minor bruising that you get. So when you get the red dots, if you get them 2 to 3 days after treatment, it's just a very, very minor bruising that is due to the treatment. And there's no downtime whatsoever, as I say, you can pretty much carry out any normal activities. The pros and cons: it covers the whole area of the face. It's relatively not painful, depending on how you carry out the treatment. In terms of the recovery duration, it's not real recovery, because after the treatment you see a bit of redness on the face. 2 to 3 days after, you can still see some red dots every now and then on the face, that part of the face that you have treated, but there's no real recovery required. There's no real downtime. So there's no downtime as such. It's applicable. You can actually use it on all skin type from 1 to 6. There's no anesthetic that is required, and you cause no injury on the surface of the skin of the epidermal layer. Therefore, you're not causing any possible infections, because the area that is injured is inside the skin. You still can get some bruising, so 1 or 2 days after, or some red dots on the skin. The redness that you get it immediately after the treatment. A tingling sensation is there. Temporary paralysis is extremely unlikely, and you know how to avoid it. No damage normally has been reported as permanent with this sort of treatments anyway. The results appear in a few months, typically 2 to 3 or even more, because the damage that you've caused is inside the skin, and it takes time for that collagen to replenish, and it takes time for that result to show a bit longer than lasers, because in lasers you get the almost immediate effect soon after the downtime, because you get damage onto the epidermal layer. So that shiny effect of either the laser treatments or IPL or plasma treatments and so on, is due to the thermal effect of that particular treatment, and the damage that you've caused as well as the damage that you've caused on the epidermal layer. In this case, the epidermal layer is completely intact, so the rejuvenation is from inside outward, and it takes longer for that to show. So you get also long-term effects, and you improve the fine lines, and improve also the appearance of deeper wrinkles as well. It's not as if you've got a magic wand, but you can help. Get some before and afters. It's just mainly some skin tightening effects. You don't get something major anyway. You get some skin tightening effects, and skin rejuvenation effects. So skin tightening and skin rejuvenation, never facelifts results. So you should not talk about these treatments as a non-surgical facelift, as it has been advertised in other countries. And so look, how many treatments are necessary? It really depends on what you want. Pretty much you can treat the area after 6 months if you want. You can retreat it, you can treat it again, or even less than that. There's no problem, it's up to you. Just to recap, I want to recap it. If you want to know more about this, you can actually go on our other training videos. Basically, with 4.5, you target this area, 4.5, no other parts of the face or the neck. With a 3.0, this area here, as well as you can see there, and this area, and also this area, avoiding that part and this area here. And then with a 1.5, pretty much the whole face if you want. And good news for us. and this is also why we're investing in it, is the legislation in the European Union is not targeting these devices as medical devices in 2020. In 2020, only lasers and high-intensity devices with that produce a high-intensity light, which in turn produces heat inside the skin, will be classed as medical devices, not the sort of devices. So we're very clear of the medical remit, which is quite good. So that allows us also to invest in this in the training for these devices. So it's really good, and there's no change for this foreseeable future. The good thing about the EU legislation is that it takes several years for anything to happen. So in our view, only in our view, is a good thing. Again, in our view, because there's not any restriction that is actual. Again, is our particular view. This due to real safety. It's not. It's just protecting the lobby of certain people, either doctors or whoever. That's what the legislation is for, especially at European levels. And that's pretty much it. So if you want to know more, visit our website and get in touch. We hope that you found this video of interest. If you want to know more as well, you can still browse our website. You'll find loads of training videos on this sort of treatment. And thank you for watching.